American Spine Registry, ASR, is a joint effort of the American Association of Neurologic Surgeons and the American Academy of Orthopedic Surgery. Both organizations have worked in the registry space over the past 10 years. The AANS developed something called the QOD, Quality Outcomes Database, that we were part of, but it was primarily neurosurgical. Over about a 10-year period, it was the largest spine registry in the country. And at the same time, AAOS put a tremendous investment into a national hip and knee joint registry called American Joint Replacement Registry. And they built a really robust infrastructure. So when AAOS was looking to broaden their registry portfolio to include spine, my suggestion as I was sitting on their registry oversight committee was this was really something that should be done in conjunction with neurosurgery. Spine is split about 50% ortho, 50% neuro around the country. So working together was much more likely to be able to engage important partners and create a functional national registry. I think a lot of people thought that was a good idea, but were skeptical about whether neurosurgery and orthopedics could really come together in that type of effort. But in fact, they have. And there's been really strong leadership on both the ortho and neuro side to bring this together. And this registry launched in January of 2020. The goal in year one was to have 120 centers. And now about 3/4 of the way into the year, we already have 150 centers. So it's running, really getting a really great start at this point in time. It's set up to be accessible to really anyone practicing spine. It's not set up to be something that requires a lot of manpower and can only be done in academic centers. The data pull, except for patient-based outcomes, is automated. So really, it's taken from the hospital EMR, and there's relationships with a very broad range of EMRs, from big ones like Cerner and Epic to this is something that's up and running in ambulatory care centers. So it's a very robust platform, and I think that over the next couple of years, it's going to create capability to have really quality data for spine practitioners across a very broad range of the US. So each center can access their own data in an unlimited way 24/7 through a portal that's called their Registry Insights portal. So they can get at their own data for benchmarking against regional and national standards, for research purposes if they want, for a broad array of applications. There's also in this registry a really unique capability to follow the patients longitudinally, because we have a relationship with Medicare that no other registries have. So every patient in the registry is tied to their Medicare file. And that means if a patient has an operation in your center, but has a complication or a follow-up somewhere else, that patient isn't lost to the registry if they're a Medicare eligible patient. So it has tremendous capability in terms of longitudinal follow-up. Also, it's the only registry that has detailed implant data. So each implant is lot specific data entered into the registry. So you know every screw, every rod. So there's a great deal of implant data that's never been part of a registry as well. And then a requirement for the registry for at least a baseline level of patient-based outcomes. So bringing together all the things that we recognize as being important, but that we've never really successfully brought together previously.